We will now use the raise instruments in endodontic treatment of a patient. The tooth in need of treatment is a maxillary left first molar with the diagnosis symptomatic pulpitis. The planned treatment is pulpectomy and root filling. The patient is anesthetized and we have prepared the access cavity, removed the coronal pulp and located the 4 root canal orifices. A rubber dam has been applied and the field of operation is disinfected. The working length is determined by means of an electronic apex locator. For the sake of demonstration, a tooth length radiograph with instruments in the 4 canals was also taken. The root canals are then hand instrumented at least to size 15 with stainless steel K-files. The engine-driven crown-down instrumentation can then begin and is carried out in wet root canals. We use our standard sodium hypochlorite irrigation solution as needed. In the rather wide palatal canal, we prefer to use 3 pre-raise instruments. We plan to use 1 instrument with taper 04 for preparation of the middle portion of the canal, and then taper 02 instruments for the apical area, probably to size 60 in this case. The 3 buccal canals are of course narrower, and in these canals we use only the 2 smallest pre-raise instruments. We plan to use 1 04 taper instrument in the mid portion of the canal and then 02 taper instruments apically to size 40. So here we go. Palatal canal, pre-raise instrument size 40 010 taper. As in the plastic models, we use the rotary instruments with a light hand and only with 3-4 strokes in order to minimize the frictional resistance in a canal. Then the pre-raise instrument 3508 taper. 4 light strokes. With this instrument, we then also begin the instrumentation of the buccal canals. Again a light hand and only few strokes in each canal. This is canal view of a mesobuccal canal, and we see how the instrument effectively brings out debris from the canal. We will now show the completion of the instrumentation of the palatal and 1 buccal canal. Pre-raise 3006 taper. Palatal canal 3-4 light strokes. Distobuccal canal the same. Change to raise 2504. Palatal canal, and distobuccal canal. Then instrument raise 2502. Palatal canal, and with this instrument to working length. Distobuccal canal and to working length as well. Instrument raise 3002. Palatal canal to working length. Distobuccal canal to working length. 3502, palatal canal and to working length. Distobuccal canal and to working length. Raise 4002, palatal canal to working length. Distobuccal canal to working length, and in the buccal canals the instrumentation is completed with this instrument. In the wider palatal canal we continue with instrument 5002. And finally, in the palatal canal, instrument 6002 to working length. All canals are now clean and properly shaped. The canal walls are smooth and the canals can easily be obturated. Here we see the orifices of the instrumented canals, and here we see the orifices after the canals have been filled. A post-operative radiograph shows the tooth after completion of the treatment.